Okay, my name is Renee. I'll be doing my first tutorial. And what we'll be doing here, this is actually a nursing tutorial. And what we'll be starting with today is respiratory terms. What I'll do is ask a series of questions or definitions, whatever you want to call them. And this is things that'll be a great reference for nclex as far as respiratory goes. So I'll start with actually the question, and then shortly after that, I'll give the answer. So if you are taking it like a quiz, the best thing to do is after I ask the question, go ahead, pause the video, and then because the answer will follow. Okay, first question. A blood clot or other substance in the circulatory system that travels to the blood vessel where it causes blockage. Okay, that's an embolus. Okay, our next question. Irritation of a major lung passageway or either infectious disease or irritant such as smoke. Chronic bronchitis. A substance that causes an allergic reaction. An allergen. A condition in which the body cells and tissues do not have enough oxygen. Now that's an easy one. Hypoxia. A condition characterized by a chronically high blood level or carbon dioxide in which the respiratory center no longer responds to high blood levels of carbon dioxide. Carbon dioxide retention. Next question. An infectious disease of the upper respiratory system that may cause partial airway obstruction and characterized by a barking cough, usually seen in children. Croup. Next. Potentially life-threatening viral infection that usually starts with flu-like symptoms. SAR, severe acute respiratory syndrome. A buildup of fluid in the lungs, usually as a result of congestive heart failure. Pulmonary edema. A disease of the lungs in which muscle spasms in small air passageways and produce a large amount of mucus with swelling of the mucus lining of the respiratory passage, results in airway obstruction. Asthma. A partial or complete accumulation of air in the pleural space. Pneumothorax. An infectious disease in which a membrane forms in the lining of the pharynx. This lining can severely obstruct the passageway of air into the larynx. Diphtheria. A viral infection usually associated with swollen nasal mucous membranes and production of fluid from the sinus and nose. The common cold. Crackling, rattling breath sound signaling fluid in air spaces of the lung. Crackles. rapid or deep breathing that lowers blood carbon dioxide levels below normal. Hyperventilation, a disease of the lungs in which there is extreme dilation and eventual destruction of pulmonary alveoli with poor exchange of oxygen or carbon dioxide. It is one form of chronic obstructive pulmonary disease, which is COPD. What's the answer? Emphysema. Stop the smoking. An infectious disease in which the epiglottis becomes inflamed and enlarged and may cause upper airway obstruction. Epiglottitis. A harsh, high-pitched barking inspiratory sound often heard in acute laryngeal upper airway obstruction. Stridor. An infectious disease of the lung that damages lung tissue. Pneumonia. A high-pitched whistling breath sound characteristically heard on expiratory in patients with asthma or COPD. Wheezing, always associated with asthma. Don't forget that. NCLEX alert. Back system to control respiratory when oxygen levels fall. This is called hypoxic drive. A collection of fluid between the lung and chest wall that may compress the lung. Pleural effusion. A slow process of dilation and destruction of airway and alveoli caused by chronic bronchial obstruction. COPD, chronic obstructive pulmonary disease. Sharp stabbing pain in the chest that worsens by deep breath or other chest wall movements, often caused by inflammation or irritation of the pleura. Pleuric chest pain. Shortness of breath or difficulty breathing. Dyspnea. A blood clot that breaks off from a large vein and travels to the blood vessel of the lung, causing obstruction of blood flow. A pulmonary embolism. Coarse breath sounds heard in patients with chronic mucus in the airways. Bronchi. Now that's just 26 respiratory terms that is must know terms, especially if you're studying for NCLEX. I hope this helps you nursing and medical professions. And I always try to dress for the occasion for my tutorials. Charity School of Nursing, New Orleans, Louisiana. Great school.